My name is Melody. I'm from California Cohort 39. This is week 1 of my journal reflection. 3 ways my nursing care skills expanded during the week are my organizing and prioritization skills, and an improvement on priming tubes. My organizational and prioritization improved this week because I had 2 patients to focus on each day, and I got to practice effectively organizing and prioritizing assessment, medications, interventions, and post-intervention assessments for both. Also, whenever I prime, my tubes always seem to get a lot of bubbles in them. So now I make sure to open the line slower and hang the bag higher to avoid creating bubbles. 3 things I would do differently if I encountered a similar situation again would be to make sure I followed each intervention with a post-assessment, find a suitable technique for myself to remember my to-do list, and to give reports that are straight to the point for the oncoming nurse. I can set alarms when things are due or make a to-do list because I know I can get sidetracked, and we'll need reminders for things like post-intervention assessments. Lastly, I found that when I give report, I spend too much time giving information that the oncoming nurse could easily obtain from the chart. I need to practice giving better narratives on the patient's situation and background. Additional skills that I need when encountering this situation in the future would be to work more shifts and practice different organizational techniques to see what works for me, as well as practice giving more reports. And understanding the patient's situation and background more in depth. One event that stood out to me this week was an 84-year-old man that was admitted for hypoxia due to respiratory distress and weakness. What brought him in, however, was a sudden inability to walk when he used his walker, so he was placed on fall risk. After breakfast, he asked me to help him urinate. He used the urinal while sitting in bed but was unable to void. I remembered his medical history of prostate cancer, so that was probably making it difficult for him to void. I asked him if standing would help him urinate, and he agreed. I told him to dangle his legs at the bedside first and then stand up when he wasn't dizzy anymore. I told him to stay seated before standing up. He was able to eventually stand and void, and what made it meaningful was that my nursing judgment was effective and the intervention worked. A key behavior that was met was safety and quality by anticipating changes in multiple patient conditions that could lead to a need for urgent or emergent care, recognizing them promptly, and initiate appropriate interventions. For the patient in my situation, I made sure he dangled his legs first to get used to being upright because I knew he might feel dizzy due to his respiratory diagnosis and weakness. Then I reminded him to stand up, to stand close to the bed, and use the railing and my hand for stability. As he was able to complete each action, I felt more comfortable having him complete the next step in standing up. A key behavior that can be improved during my next shift is safety and quality by demonstrating appropriate level of independence in provision of patient care based on my own strengths and limitations. My actions may not have been the best because I should have called another nurse or clinical partner to assist with a fall risk patient. At the time, I felt like I could do it myself because the patient stated that he had stood up before. But when he said he felt dizzy, I started to get worried about the situation. I could have used the call light to ask someone to come in or have 2 people ready before the patient stood up. I learned to remember safety first in this situation because if the patient fell over, there would have been an adverse event for myself and the patient.